I've been mentioning the last few weeks that we're going to be talking with the folks at Tripp Family Medicine about allergies and asthma issues. I have a friend, in fact, he used to fly around in jets at 500 miles per hour for the Air Force. And at age 62, he got diagnosed with asthma. And he said it was a real surprise because he's been in great shape all of his life. And now he has to deal with allergy issues atop that, and it's not fun. Uh, we have Lauren Bostrom in studio with us today. She is a physician assistant at Tripp Family Medicine. We're at 43. Oh, we just jumped to 45. It's 8:34. And Better Health with Tripp Family Medicine on KLIX until 9 o'clock today. And I guess the jumping off point, Lauren, is first of all, welcome back.
And thank you.
We,
Yeah, it's been a few weeks.
in fact, we've been talking about this allergy idea really since spring got started a little over a month ago. Of course, we were just joking off air. The weather has been cold enough in some instances where some of it has been muted, but it's not necessarily, it doesn't, of course, certain allergies are there year round, obviously.
There are, and there's some people who struggle with them all year round. And my topic today is what we call the triad in medicine. It's allergies, asthma, and eczema. And often when a person struggles with one of them, they can often struggle with two or all three of them. And all of these are related with an inappropriate response of our immune system to our often environmental triggers or sometimes food allergies too. And so this is one of those topics that I think a lot of people struggle with one or a couple of these issues. And so I wanted to talk a little bit about it on the air.
Of course, now we tend to think that, we do have them year round. Some people have dust allergies and other various issues, and animal allergies, food allergies, as you've mentioned. But I used to live in a part of the country where I lived I lived at the side of a mountain, and my house had wildflowers that would pop up in the spring all around it, and immediately my life would take a turn for the worse. So spring was always one of those parts of the year that I did not like, and even fall. In fall, sometimes you get another specific set of them, uh, but there are controls obviously for these things for a lot of people.
There are, and I encourage people if you're someone who's been struggling and dreading the springtime, talk to your doctor, or I have a couple of just things you can try over the counter too to try to help you actually enjoy the warmer weather instead of waiting for winter to come. So as far as allergies goes, the interesting part is if you have a parent who struggles with allergies, there's about a 33% chance that you'll also develop allergies. And when both of your parents struggle with them, that goes all the way up to 70%.
Wow.
So there's a huge genetic component to all of this. One thing that changed recently, this kind of back in November, as far as first line for allergy treatment, used to typically reach for things that are called antihistamine blockers, like Zyrtec and Claritin. But now there are these new nasal steroids that are out, including things like Flonase, Rhinocort, and the American Allergy Association has now said that's what we should be reaching for first. How they work a little bit differently, they block 6 different ways that our body develops an inflammatory response to allergens. And I know a lot of people struggle with the idea of putting something up their nose, but I can tell you, for a lot of people, it's pretty life changing, including for my husband. He was kind of struggling for a while after we moved down here, and he was at the point he was snoring in bed, and I was kicking him out, and we finally got him on some nasal steroids, and he's a lot better to be around.
It made a difference that it just eliminated that, right?
It did. It really made a huge difference for him. He actually had to try a couple of different ones before he found one that really was effective for him. And everyone's very unique. So if one type doesn't work for you, it's worthwhile to try a different one.
Flonase is the one with the bumblebee. If you watch the commercials, I mean, some of these things, the message is well done, so I know that name.
Yes.
That's the bumblebee with the accent. But you had referenced the Claritin and some of the other medicines we had beforehand had side effects, drowsiness specifically.
Especially things like Benadryl. So if you're someone who's been using Benadryl for allergies, I encourage you to reach for something else because not only can that make you drowsy, but over time can actually cause high blood pressure too.
So these other alternatives, these new alternatives, will not leave you sleepy when you're using them.
They shouldn't, and I will tell you, there's some patients who are a little bit extra sensitive. Dr. Tripp actually could speak to this himself. So he tends to get kind of a paradoxical effect from some of these typical antihistamines that shouldn't make you tired. I know he's been doing well with a newer allergy medication called Zysol that came out on the market. It's a sister to Zyrtec. And I don't have any money in any of these names, so I'm just kind of throwing out common ones so people can find them over the counter if they're on the hunt to find a way to survive this allergy season.
I was going to say, we've got about 30 seconds before the break. Uh, Very quickly, we'll get this out of the way now. People who'd like to get in touch with Tripp Family Medicine, what should they do?
So we have a phone number that you can reach. It's 933-4400, and our address is 1411 Fillmore Street across from the post office.
It's good to know. And we wanted to point out, I've always said across from the main post office. I should have been clearer on that because some people consider that to be the one downtown and not the one on Fillmore Street on the north side. So, but it's across the street from the post office on the north side, and you can't miss the big sign outside with the logo. We've got a short break. We've got more with Lauren Bostrom. She's a physician assistant at Tripp Family Medicine here in Twin Falls. It's 43. We're talking allergies and asthma. You can also join the conversation following the break at 208 736 0300. That's 208 736 0300. And we've got, well, our temperature has been bouncing, ping-ponging all around, back to 43. Joining us in studio is physician assistant Lauren Bostrom. She's joining us from Tripp Family Medicine here in Twin Falls. It's 43, and we're at 8:43. And we're talking today about allergies, and a lot of them, as well as asthma, and sometimes some combination thereof. And she's also available to take some of your telephone calls. I'm going to call it 8:43. We're coming up on 8:44, and it's 44 as far as our outdoor temperature goes this morning. And telephone number 208-736-0300. We have a caller who'd like to speak with you.
Okay.
Caller,
Perfect.
you're on the air. Go ahead.
Good morning, Lauren. This is Pat.
Hi, Pat.
And one of her patients. I want everyone to know that this is a very fine doctor, and she does a great job. And that facility is unbelievable. If anyone's looking for a great place to go that you can just trust them with your life, this is the place to go.
Oh, thank you, Pat.
Anything else, Pat?
That's it. She's a great doctor. I've only had 4 doctors in my life, and she's number 4. And I've never had a lady doctor before, and I'll tell you what, you can trust her with your life.
Well, thank
said.
you. That means a lot.
I met Pat at the fair a couple of years ago, so I'll vouch too that he's a pretty good guy as well.
He is a very great guy.
We were talking a little bit about the asthma component in some of this. And I was sharing off air that my sister's had asthma since young childhood. And, it's been with her for decades. And there have been some real ups and downs in all of this. But allergy season for an asthmatic in particular is going to be difficult.
Especially hard. If you struggle from a combination of both, allergy and asthma, and there's a type of allergic asthma that people can have, it can be a really tough season. And often what happens with people who have asthma, they have an increase in inflammatory markers that causes the muscle around their bronchus to spasm and tighten, and it can be a real miserable time of the year. And as far as management of that goes, we have different inhalers that we can use for asthmatics, and everyone has kind of a different degree of asthma, and we use what's called a step-up program to determine what type of inhaler someone might need. And sometimes people may need a little bit of extra help during the allergy season. And so I often have patients that we're doing a long-acting inhaled steroid along with a long-acting medication that is called a beta blocker that is the same as albuterol. It's a little bit well-known, but longer-acting to help them survive the season. For some people, it's actually bad enough that we send them up to the allergy specialist to do what's called immunotherapy, where the allergy specialist determines maybe what their environmental triggers are and can actually give them small injections of the allergen that's been triggering their asthma to help sensitize them. And this is actually something that we often do for people who have really severe allergies too. In particular, I want to point out for kids, this could be an especially beneficial thing if you have a kid with really bad allergies. They've done some studies and found that this can actually reduce their chance of developing asthma later in life.
I was just thinking when you were talking about all this that some allergies are not just common, but can be deadly for people. I have not been. I think it's been decades since I've been stung by a bee, wasp, hornet, anything like that. I never had any serious issues. I think one time I got one of my fingers when I was a kid. I got zapped and my finger swelled up for a day and I couldn't bend my joints. But other than that, that was the worst reaction. But I know people out there who their lives are in danger if this happens.
And there are people who will develop what we call anaphylaxis from an allergen exposure, where it could be presented as things like facial swelling to the point that their airway is closing, and they can't breathe. And these are folks that we're giving EpiPens to have on hand to carry with them. And we'll tell you that often I'm running into patients who've had this type of allergy and do not have their EpiPen with them. There is now some generic options. Recently the EpiPen had gone a little bit expensive, so a lot of patients were bypassing it. But there's some generics out there, although we are going through a little bit of an epi shortage in the nation. So I'm not quite sure where our pricing is falling in the pharmaceutical market right now, too.
And those are extremes, of course, when it comes to allergies. But just for most people, I think some of what happens when you get to certain times of year, your exposure to certain elements or chemicals or something in the air, it's more of just an irritant than it is anything that's going to sideline your life.
Most of the time, yeah. For most people, it's a matter of quality of life that we're speaking about and trying to find ways to manage and survive the season. And for my asthmatics, I have patients who kind of go, how do I know if I'm a controlled asthmatic? And when do I need to maybe look at changing my current medication regimen? A lot of times we're looking at symptoms, including things, how often are you using your rescue inhaler? By the guidelines, you probably should be using it less than 2 times in 2 weeks. And if you're using it more than that, that's probably a good time to speak to a provider.
Years ago, I think I was in the fifth grade, I was in the hospital for about a week, not quite a week. And a nurse came in and she probably was drawing some blood, but she put a needle in my on the inner part of my elbow on the left arm, and then she took a bit of rubbing alcohol on cotton, wiped it clean, bandaged it. When the bandage came off, I had a great big blister there,
Yes.
and that obviously was an allergic reaction of some sorts too.
Yep. So, somewhat going into eczema a little bit, in the same way we can have irritants that cause our skin to get irritated, and we can have inappropriate inflammatory responses to certain exposures, including things like adhesive. The other things that I see really commonly are people who are struggling with either eczema or a rash on their hands because their job requires them to do a large amount of hand washing, and they happen to be sensitive either to the soap or detergents they're having to use at work. And sometimes it's just a matter of that excess water exposure that we're having. They found that there's a genetic defect in people who have eczema where they just don't have the same barrier of skin than people who don't struggle from eczema.
We have a caller with us. And caller, you're up next. You're on the air on Better Health with Tripp Family Medicine on KLIX.
Morning, Bill. Jay Waters.
Yes, sir.
Hey, I was just curious as far as the individual practice goes, if you guys are looking into how closely you guys look into these allergen sufferers' diet.
The diet?
And,
Yeah.
yeah. And see, a lot of immune deficiency diseases are being treated with, removing things that lead to higher inflammation markers in your blood. Refined carbohydrate, starchy carbs, stuff like that. I'm wondering if you guys are looking at any of that to offer relief in, the day-to-day sufferers.
Yes. So a lot of times if I have someone who has severe enough allergies that I'm worried about diet, often I'll be sending those folks to the allergy specialist. But depending on, sometimes there's an association with gluten allergies for a lot of these folks. So I see people who have things like celiac disease, and they can have a rash that shows up. I like to check to see, are we having a lot of nausea, bowel changes? And if so, then I am starting to go down the road. Let's try to eliminate some foods and add them slowly back in to see if your symptoms are getting better too.
I want to thank you for the call, but that is true that a lot of us have. I had a friend who had celiac disease years ago, and people have developed certain things. Certain people who, because of the genetic makeup of their ancestry, can't digest certain foods, and so you go into restaurants today, and there's always a list, it seems, of foods that are made for various people, the gluten-free diets and the like. But these are things we didn't even recognize, I think, in most cases 30 years ago.
Yeah, and I can tell you I have a lot of patients that don't necessarily have a true gluten allergy, but I get what I'd call an intolerance, and have had improvement in things like joint pain, stomach upset, with eliminating gluten from their diet too.
I changed my breakfast routine some months ago, and I don't want to knock the product that I'm no longer using, but I changed what I'm eating for breakfast, and I found out that it was much better for. I didn't have the stomach upset, and my GI was better. And so again, it may be related. I don't think I was ever tested for anything. I just stumbled across this by chance.
Yeah, and it's kind of something that our bodies can give us a good idea when you can correlate. If I'm not feeling well consistently on a daily basis, food's a huge place to start looking and saying, there's something I'm eating every day that's irritating my stomach. I actually found out eggs and me don't agree very well from trying to correlate that for a while, because that was what I would have for breakfast in college, and I was throwing up about every day, and I'm like, why am I doing that? And it took me probably longer than it should have to put that together because I was in denial. But for a lot of people, including people who struggle from really bad heartburn, there's a diet called the FODMAP diet, and it's looking at eating foods that have low fermentation, and can help the stomach settle a little bit better too.
And you referenced the skin allergies. I worked my way through college working in a kitchen in a hospital, and in order to clean that kitchen when we were done at the end of the day, we had a lot of very powerful cleaners. And it didn't bother me, but I know people I worked with who often had skin irritation just from the soaps or what we used on the floor. We used a product called Regain for a lot of the cleaning. And again, if you don't get that diagnosed pretty soon, I think that caused a lot of people skin irritation to the point where they may have had some permanent skin damage.
Yeah, I see patients coming in. It can be pretty pronounced. They have actual blisters that form on their hands. It's a type of eczema we call dyshydrotic eczema, where you have excess water exposure, and you can get pretty severe, debilitating changes to the skin.
Couple of years, well, it's been almost 6 years, I guess. I lived I rented half a house out, and I remember my hands got terribly, they almost looked like they'd been burned. They were scarred, and the doctor thought it might be eczema. Then I moved, and all of a sudden my hands cleared up. So there was something environmental in that home that I was living in.
Yes, and I think that's a big struggle for a lot of people, because a lot of people's allergies can stem from the environment they're in. So one thing I like to chat with, I get a lot of questions about in the clinic, is mold, and a lot of people having concerns about black mold. Black mold, it's not deadly. It's more the allergen that we're concerned about, the environmental trigger. So people can start to have trouble breathing because of
Mhm.
the allergic reaction, similar to what people with asthma have. And so mold itself it's usually not deadly, but it's more the allergen exposure and getting rid of it in the home, which can be really difficult.
We've got a caller with us. We've got time, I think, for one last call. Caller, you're on the air on Better Health with Tripp Family Medicine on KLIX.
Good morning, doctor. You sound pretty sharp there. I was going to say, remember the old adage they teach you years ago, my grandparents, Socrates, let your foods be your medicines. I've
Yeah.
kind of run with that, a couple of vitamin C's and different things over the years, but I've never really been sick my whole life. I was born premature back in the 50s, and I'm 6'3". I'm big as a horse. I mean, Bill knows who I am. I said, I'm nothing
Yes.
but trouble, but I'm
He
in
could snap a
occupation
tree in
where-
half if he wanted to.
Right, exactly. And I'm one of those guys that I work for a living and do different things. And I tell you what I found too, and you'll find this you probably know about it, is people move from different regions of the country constantly in business, like I do, and other people by airplane, and you're always driving to Las Vegas or driving to Salt Lake City. Everything changes when you're there, and all I can say is wash your hands about 1,000,000 times, because I think that's the secret.
That is a good point, definitely.
I want to thank him for the call. He references moving to different parts of the country. Maybe we're getting close to the end, but when I was in school, one of my best friends, his parents or grandparents owned an enormous dairy farm, and they had to sell it off and move to Arizona because his grandfather had a terrible case of asthma that came on as he was getting older, and Arizona was much better on his lungs than running the dairy farm. And of course, dairy farm is exposure to a lot of potential allergens.
It is. I have I could count lots of patients that I can remember coming into my clinic saying I'd never had allergies until I moved here to Twin Falls. So we're probably a good place to find out that you have new allergies.
Yeah,
So
and the topography sometimes can be a determiner. We've got canyons here and mountains nearby, and then you've got a lot of agricultural business going on, and that adds to that pollen. I'm sure
and the
before
sage
before this
brush.
area was settled, there may have been a lot less in the way of pollens.
Yeah, I would imagine that all the commuting and we've brought in new plants, new environment triggers that maybe weren't here a while ago. And so the world's consistently changing for better or for worse. And we're continually trying to find ways to make it better for all our folks that are struggling with allergies and
You say that
asthma.
too. Remember, there are treatments available for just about everything we've talked about.
There are. And so if you are struggling, please don't hesitate to come in because we are more than happy to help. And I've had already a lot of patients really struggling. And actually, a couple of them just went to travel and then came back and started having allergies. So,
I told Lauren about a story a couple of beginning of the show where we weren't on the air, but I mentioned going out to work and it lasted about a week and then it passed. This was 3 weeks or so ago, where I'd get about 15 steps and I'd have machine gun sneezing, and then it would go away once I got in the car and drove to work. But whatever was out there, it didn't last long, only a week. But these things will crop up from time to time.
they will. And again, we're Tripp Family Medicine. And if you're looking to make an appointment, call us at 933-4400. I would say we do really well at getting patients in within at least 48 hours.
Well, we want to thank you again for dropping by. And with the way the rotation goes, we could see you next week or next month.
You never know.
All right, super. Thank you. Lauren Bostrom, she's a physician assistant at Tripp Family Medicine here in Twin Falls. We've got news on the way. Coming up in the next hour, Janice McGee, and she's a candidate for Lieutenant Governor in Idaho. That's on the way following 9 o'clock news this morning on KLIX.